So my name is Samelia Obing-Jesse, and I'm a breast surgical oncologist here at The Ohio State University. So social factors have significant implications for breast cancer outcomes, and I'm actually going to broaden the term and use socio-environmental factors, which are a combination of social and environmental factors. So some of the studies we've done, for example, have shown that patients who file for bankruptcy have a much higher rate of mortality. Some studies have shown that patients who live in neighborhoods that have a high amount of racialized economic segregation, so racial composition and also low socioeconomic status, tend to have poor outcomes than those who live in areas that have a high socioeconomic status with a different racial composition. So social factors, including the neighborhood contextual factors, have been shown to be associated with breast cancer outcomes and actually across the breast cancer continuum itself. So this was a study that looked at two exposures, so neighborhood opportunity. And neighborhood opportunity describes local conditions and resources that promote healthy development within a community. So we wanted to understand that for patients who come to receive treatment at our facility, does the neighborhood that you live in, does that have implications for your overall mortality, which is death from any cause? And also, is there an association between the neighborhood you live in and biological measures of stress, which we called allostatic load? So allostatic load is a biological correlate of your exposure to social environmental stressors. Essentially, it's the way that your body deals with with stressors, and it's the wear and tear on your body from facing multiple stressors or facing the same stressor. So in this study, we wanted to understand if neighborhood opportunity and allostatic load, if they were associated with overall mortality, and also if they interacted with each other to influence overall mortality. So what we found were that individuals who live in neighborhoods with low opportunity, once again, low opportunity means a resource-poor neighborhood, that individuals who came from these communities were more likely to have a higher all-cause mortality than individuals who came from neighborhoods that were resource-rich. We also noted in the study that individuals who came from neighborhoods with a low opportunity also had higher levels of biological correlates of stress, so they had a higher allostatic load compared to individuals who lived in neighborhoods with more resources or higher opportunities. So our findings are not surprising, as one would anticipate. Individuals who have less resources will be more likely to have higher levels of stress, and also subsequently will be more likely to have higher mortality than individuals who have more resources and also who have less stress. Clinical implications are that the Centers for Medicare and Medicaid is now requiring that for all our inpatient patients, that we collect information on health-related social needs and social risk factors. So what this tells us is that this is a great thing for our patients because we're going to have a much more holistic approach to their care. So instead of just focusing on diagnosing someone with a disease and then treating them, we're also going to try to understand what resources that they need to be able to participate in their care and also to have good outcomes. So that's one part of the study that sort of confirms that. The second thing is that for allostatic load in particular, studies have shown that psychosocial support and exercise can help mitigate that. And so this is something that we have in our clinical practice. We can think of individual level factors that patients can implement to help reduce their stress.